Afternoon, ladies and gentlemen. Special welcome to members of the media who are attending with us here this afternoon at the Diplomatic Center. As we normally would on these occasions when we update you on our response to the COVID-19 challenges and other issues, I would like today to use the same format and ask Dr. Parashram to lead his team through the presentation of our COVID response data at this time.
Hi, good afternoon. Thank you, Honorable Prime Minister, Honorable Ministers, members of the medical team, members of the viewing and listening public, members of the media. So the update for 12th of November 2021, at both public and private facilities, we have 411,606 tests done so far, which in the last 24 hours we would have reported 535 new positive cases. Total recovered patients so far, 53,092. Total positive cases since March 12th to present, 61,519. Active cases now stand at 6,599. Those in home isolation, 5,584. Those in hospital, 406. Step down, 74. Quarantine sites, 93. Honorable Minister will present the vaccination status. And I'll now ask Dr. Hines to begin with the EPI update as is usual. Dr. Hines?
Thank you, CMO. Good afternoon, Honorable Prime Minister, Honorable Ministers, colleagues, members of the media, members of the viewing and listening public. Today's EPI update contains data as at yesterday, November 12th, at 4 p.m. As at that date and time, what we see with the EPI curve, the epidemic curve, is a gradual, steady, and now accelerating increase or upswing in that rolling average, that dotted line that is passing through this colorful graph, that dotted line we're now seeing taking an upward slant. It has been doing so basically since the start of October, and has now begun to take an even steeper upward slant as we move into the first 2 weeks of November. When we look at that data on a week-by-week basis, it's perhaps a little easier to see. The bright green bars are the weeks that correspond to the month of October, and the darker ones are the ones that correspond to the weeks in the month of November so far. And what we see is that there has been a steady week-on-week increase, at first smaller, but getting larger from 1 week to the next as we move from week 40 through to week 45. This is a cause for concern, and it is also reflected in the increase in what we call the positivity, the percentage positivity, meaning the number of COVID tests done that come back as positive out of the total. So whereas you would have seen that peach or salmon area in the background hovering between 25 and 30%, it crossed 30% and jumped to above 40, it's about 42%. In that last week of data collected, week 45, and last times that we would have seen that kind of level above 40% was when we were looking at or staring on the barrel of surges approaching peaks both in the July period of 2020 and in the May-June period of 2021. So this is something else that we need to keep an eye on in terms of the upward trend. Looking at that same data on the monthly time scale, we see the similar pattern, October being a little higher than the previous 3 months, and November rapidly catching up. This is the total for November. We haven't reached halfway through November yet, and yet we're approaching half of the October total relatively quickly. And the monthly percentage positivity for November hovers above 35%, as opposed to the 25 to 30% that we've been seeing from July through to the month of September, and even October. From a demographic perspective, the age and sex distribution cumulatively hasn't been changing too much. It's been maintaining pretty much the same shape. The fattest part, the widest part of this pyramid is still that age group 25 to 49, which is a mobile, young, working age group, and that accounts for about half the cases. And then when we look at the male-female distribution, it has remained more or less even. just about 50-50 right now. There's a small predominance of female COVID patients, but nothing to remark about. We'd still call that 50-50. When we look at the fatalities, we see that that data also is maintained more or less the same shape, where we have a top-heavy pyramid. So the top, meaning the higher numbers or higher ages, above 60, corresponds to about 2/3 of the actual fatalities. And what's not shown here, but what we speak about all the time, is now two things. One, the presence of what we call comorbidities or pre-existing conditions among those who have died. And also the fact that as vaccination has become available, and we've looked at the patterns of deaths, we've noted that the vast majority of individuals who have passed on have been the unvaccinated or incompletely vaccinated persons. Looking at the geographic distribution, we see at a community level, some communities getting those darker shades which correspond to larger numbers. Some of this is driven by clusters in given places, but we are seeing more of those darker shades corresponding to larger numbers in communities compared to the same graph a couple of weeks ago, or same map rather, a couple of weeks ago. And if we look at what happened between week 43 and week 44, at a county level, what we see is for that week change, every county has had an increase in their weekly total. So whereas previously we would have seen some counties have a decrease and some have an increase, and that kept the numbers just about the same from week to week, we've seen now an increase across the board in all counties from one week to the next. If we look at how that reflects itself over a longer time scale, what we would see is that there have been a few counties where there has been a fairly steady increase over the past few weeks, and now there's a bigger jump between week 43 and week 44 than in some of the corresponding weeks. So we are seeing that sort of acceleration even at the county level. County by county, each county is experiencing more or less the same thing. And if we look at how that translates into projected numbers of cases over the next couple of weeks, what we see is that we've had to redo the projection looking at the rate at which we have been accumulating or accruing cases over the past 2 weeks. And now that dotted line that runs off the end of the graph is showing a pretty steep upward climb, whereas we had been holding steady in a fairly regular pattern over the last few months, and the increases weren't really changing in size. Now we're having increasing sizes of increase from one day to the next, so we're having what we call an acceleration, an uptick, an upward trend. And this is, again, cause for us to remember the public health regulations and protections that are available to us, and the additional protection of the vaccination, which is really one of the key strategies in reducing the impact of increasing cases on your individual health. So I'm going to leave it there and turn you over to Dr. Richards for the hospital and healthcare system update.
Thank you very much, Avery. Good afternoon, Honourable Prime Minister, Honourable Ministers of Health, National Security, Energy, and the Office of the Prime Minister. Good afternoon to the medical team led by the Chief Medical Officer, members of the media, and Trinidad and Tobago. Also all those who are tuning in locally, regionally, and internationally. This afternoon, I would like to present an update on the status of the hospitals in the parallel healthcare system as of 8 a.m. this morning. And I'd like to start my presentation by stating that we are facing a very grim reality with respect to the occupancy levels in the hospitals and our capacity, especially in the intensive care unit departments throughout the parallel healthcare system, especially in Trinidad at this point in time. And this is a 26-day trend that we have been noting, and I'll go into a bit more detail as the presentation evolves. Dr. Hines would have just indicated that the rolling average continues to increase, and we are seeing the increasing rolling average resulting in increasing numbers of persons being admitted into hospital and requiring care. The net admissions, that is the additional admissions in the parallel healthcare system for the past week, was 91, whereas the previous week it was at 56. And although this may not seem like a significant number, the increases that we are noting tend to be for patients that are being admitted into the ICU. ICU-level patients require significantly more resources and also spend a longer time receiving care. So if a patient is admitted today to a bed, they may spend anywhere between 12 and 21 days before recovering or having another outcome with respect to their status and condition. So it means that we are adding ICU-level patients on a daily basis with a limited supply of beds, and these patients are requiring several days of care. I'm now going to discuss the overall percentage occupancy in the parallel healthcare facilities. And occupancy describes or indicates the number of beds that are filled as compared to those that are available, activated, and operationalized. And for 114 days or so, we maintained a 40%, an occupancy that was less than 40%. And that period was really between July 15th and November 9th. However, we've noticed that in the past week, that occupancy level, and that is the overall occupancy, has increased significantly. And this morning, our overall occupancy across Trinidad and Tobago is at 48%. You would see that uptick just beyond that blue line where it's taken a sharp turn upwards, or as Dr. Hines would say, there's a sharp gradient, upward gradient on it. Of more concern would be the occupancy in the ICU. And in the intensive care unit, 86% overall between Trinidad and Tobago of beds are filled. In Trinidad, this morning, there were 61 operationalized ICU beds in the parallel healthcare system. Now, we also have beds that we have increased capacity in the accident and emergency, and I'm speaking here about the parallel healthcare system this morning. In Trinidad, 61 beds active and operationalized, 53 of those beds filled, which is an 87% occupancy. But of those 53 patients in the ICU, 49 of them are not fully vaccinated. Over the last 26 days, we have been sharing with the population that 90% and upwards of all the patients in our ICUs are not fully vaccinated. And yes, we have seen high intensive care unit level occupancies since April, when we saw that the last wave. But the challenge now is that we have increased our capacity at the accidents and emergencies and at our hospitals. And as fast as we operationalize an additional bed, which requires significant resources, the beds are becoming filled. In Tobago this morning, 4 out of 5 beds are filled. None of the patients are fully vaccinated. This is indeed a cause for significant concern and very worrisome, especially given the percentage of unvaccinated and persons who are not fully vaccinated that are requiring hospital care, and we are seeing it daily. It is a trend. This is another very dismal statistic that I'm going to share with you. If you look at the last bar, week 45, you would notice that our hospitals in Trinidad that manage severely and critically ill patients, of all our hospitals right now, only 2 are under that threshold limit that we speak of. Okay, 2 hospitals, and that is the Cora and the Covert Medical and Multi-Training Facility. However, at the Covert Medical and Multi-Training Facility, the ICU is almost filled. For this entire week, that ICU has had between 23 to 25, and on some days 26 patients out of the 26 active beds. And we have doctors and nurses working 24 hours, 7 days a week, trying to increase capacity. Again, 90% or more of persons in our ICUs and in our parallel healthcare system at present are not fully vaccinated. So we are seeing a clear trend here. When we look at actual numbers of COVID-positive patients in the parallel healthcare system now, these are the numbers. Again, you would notice an upward trend noted. You would notice that the green line, which is the overall total number of patients, corresponds very closely to that red line. And what I'm showing here is that the majority of persons, significant majority of persons in the parallel healthcare system are in the hospitals as opposed to the step-downs. We are seeing now a sharp increase, and I'd just like to share some dates with everyone. On the 19th of October, we noticed a trend of increasing persons being admitted into the accident and emergency, significantly more than we were seeing since July 15th. By the 21st of October, we saw that trend now being translated and carried across into hospital occupancies. And now this is where we are at. We have gone from being under 40% occupancy in Trinidad last week to 50% plus. Today, in 1 week and 7 days, we are seeing anywhere between 50 and 60 persons every morning in the accident and emergency departments awaiting transfer into the parallel healthcare facility. And of the 50 to 60 persons there, at least 25% of them, some days 5, some days 11, one day 17, are awaiting ICU level care. And again, the statistic shows and demonstrates 90% of those persons awaiting admission, 90% plus of those persons requiring ICU level care are not fully vaccinated. We are seeing this daily. Our doctors are reporting to this when we meet with them every morning. This shows the 113-day plateau period that we had. And during that time, you know, our team presented, the Honorable Minister presented, and we asked the population and we requested, you know, please take up the vaccine. Please don't let us have to go back to this sort of dismal space. The vaccine is safe, it's available, it's accessible everywhere. 109 health centers, mass sites. We asked, we warned the population, please do not be prematurely comforted by these low numbers. We spoke about the impact, about the persons who could not be covered by the vaccine, the young children, and others who cannot be vaccinated, and our responsibility as law-abiding citizens and responsible nationals to protect those persons. But here we are, today, November 13th, with an increase, significant increase uptick over the last week, with a predominance of unvaccinated and persons who are not fully vaccinated, really seeking and requiring medical care. This shows and demonstrates the picture at the accident and emergency departments. If an individual or a patient has COVID-19 and they require medical care, and they contact the ambulance service, they have to first go through the traditional accident and emergency departments in the relevant facility, in their RHA. That's where the GMRTT ambulance that you call, that you contact, would take you. And if you look at this, you would see a sharp increase, especially from the late part of October going upwards, and it's just going up and increasing. And this is very, very concerning and worrisome to us. This morning, Saturday, the 13th of November, at 8 a.m., 47 patients are waiting transfer. 11 of them at ICU level. Of the 11 who came to the accident and emergency in an ICU level state of, requiring an ICU level state of care, none of them were fully vaccinated. 42 out of the 47 persons who have access to call the ambulance and came into the A&E over the past 24 hours and were there at 8 a.m. this morning were not fully vaccinated. And yes, we continue to try our very best, our medical team. I am here appealing, not just on behalf of the health team and the Honourable Minister and the Honourable Prime Minister and others here, but on behalf of every single frontline doctor, the medical chiefs of staff that have worked tirelessly since February 2020. We are noticing certain trends, and these are consistent, and the Honourable Minister will go into more details with them. Firstly, number one, patients are coming into the accident and emergency too late. People are contacting the GMRTT service on behalf of themselves or their relatives. On arrival, they are considered clinically ill, in critical or severe medical condition, and in many cases, some of them, they decline transfer, and then 2 days later, they arrive into our accident and emergency departments. And in this case, they have to go onto a ventilator immediately. we are noticing a 90% and upwards trend of unvaccinated persons requiring hospitalization in the parallel healthcare system. 92.3% of all admissions between July 22nd and October 27th, 2021 are in persons who are not fully vaccinated. We are now seeing children. We have 5 children in the parallel healthcare system this morning. 3 out of 5 are in intensive care units in the parallel healthcare system. Please, Trinidad and Tobago, we plateaued for 113, 114 days. We have been updating the population. Our team is trying our utmost best. We cannot continue along this path. If we continue along this path, despite adding intensive care unit beds, ward-level beds, increasing ambulances, increasing the proportion of advanced life care ambulances, we will soon run out of these resources. We are trying our utmost best to save lives. So please, we are again appealing to everyone to exercise your civic, social, and personal responsibility. Please, please, we are asking yet again and humbly and respectfully, please take up on the offer of vaccination. It's one of the few ways and the only way now that our healthcare system would not be overwhelmed. Let us protect those who cannot be vaccinated, like our children who are under 12. And let us protect those and protect ourselves from ending up and requiring care in an ICU level facility. Thank you very much for your attention, and thank you, Prime Minister.
Thank you, Dr. Richards. I would like to ask the Minister of Health to tell us now how our vaccination program has been going.
Thank you. Thank you very much, Honorable Prime Minister. Good afternoon to Dr. Parasram and his team. Good afternoon to my fellow Cabinet colleagues. Good afternoon to ladies and gentlemen of the media and the viewing public wherever you are. The vaccination program has more or less stalled. Over the past 2 weeks, we have been averaging roughly about 1,200 between first doses of a 2-dose regime and the Johnson & Johnson one-shot. We have been averaging about 1,200 per day. Our current statistics are 631,871 persons first dose. Completed vaccination, whether it's a 2-dose or the Johnson & Johnson one-shot, 626,652. And we started the additional primary dose this week on Wednesday. To date, we have done 3,262. Next slide, please. The next slide just shows you it in graphical format, same data, but what it shows graphically is a plateauing, a slowing down of the green line, which is the total persons vaccinated with 1 dose, and the aquamarine line, which is the 2nd dose or the combined together with the Johnson & Johnson first shot. What you are noticing is that the line is getting more or less horizontal, plateauing or flatlining. When you marry that with the now 7-day rolling average, which is about 430, Dr. Hines, 430, you have a flatlining population of people seeking vaccination, but a steep increase in the 7-day rolling day average, an increase in the hospital utilization at the ICU level. I want to segue and explain a little bit further what Dr. Richards has been saying. We had a roundtable yesterday with doctors of all the RHAs, the directors of health of all 5 RHAs throughout Trinidad and Tobago. And let me again thank healthcare workers. But doctors and nurses are now burnt out. I don't know if you picked up the passion and anxiety in Dr. Richards' voice today. Today is the first day I heard Dr. Richards speak in the way she spoke. But yesterday, doctors with whom I met are burnt out. They are tired. Quite frankly, they are fed up. And nurses. And what the doctors are telling me is that patients are being treated by their private sector doctors at home with a combination of the following drugs. 1, ivermectin. 2, antibiotics to treat a viral infection. There is a place for antibiotics if you have a secondary bacterial infection coming out of a viral infection. But antibiotics, as the doctors will tell you, as the doctors yesterday were amazed when they take the case history, these patients are being given antibiotics as first-line therapy for a viral infection, together with ivermectin, together with alternative medicine, together with home oxygen. And what they reported to me yesterday is that these patients are now hypoxic at home. Hypoxia means you don't have enough oxygen for 3 to 5 days before calling the ambulance and before coming to the hospital system. And when they reach, because they have been treated at home with ivermectin, antibiotics, they need to go immediately into ICU. And very often, the ambulance has to go 2 and 3 times to the same house. They call the ambulance goes. As Dr. Richards said, they are declared to be clinically in a state to be transferred to a hospital. They decline to come. They continue to take ivermectin antibiotics at home, being prescribed. They deteriorate. They call the ambulance again. This is not right. Because the ambulance that has to go to the same house 2 to 3 times cannot go to the deserving patient, non-COVID heart attack patient. So, ladies and gentlemen, we are again pleading with the unvaccinated population to do a couple of things. 1, exercise your personal and societal responsibilities to all of us to get vaccinated. As I said on a radio interview yesterday, my personal choice doesn't mean I can jump in my car and drive south on the northbound lane of the highway and kill people. I can't do that because I have a responsibility to my fellow man to behave in a way that doesn't endanger them. I cannot decide to drive my car the wrong way on a one-way street. I don't have that choice because I have a responsibility to the other driver. And I will just end by saying, Honorable Prime Minister, on behalf of healthcare workers who are just tired, to help us by doing the correct thing and by getting vaccinated. Thank you very much.
Thank you very much, Minister Dayal Singh, for your information. Ladies and gentlemen, by now you would have gathered that we are in a very dangerous place. We have, for the last few months, been responding as a population to a virus which permeates the entire society. There's no place in the country which can say it's COVID-free. We started off at the very early days, whether we had COVID or not, then we had 1 or 2 instances, then we had clusters, community spread. It is now, as some countries have literally declared it, that our condition is that the virus is pretty much endemic in populations worldwide. And the treatment of the virus is still the biggest challenge that we face. We cannot truthfully say that the virus is not in our population. Even heavily vaccinated populations in some European countries, where they are upwards of 80% vaccinated, they too have a virus problem. And therefore the question is, what do we do? The one thing we know for sure is that there is something that we can do to bring some relief, some control, some management. And that thing is to use the vaccines that are available so that, and let me repeat this, not so that we will not get infected. There is no condition available to the human beings on earth that will prevent them from being infected if they are exposed to the virus. That is a fact. If you are a human being, wherever you are in the world, vaccinated or otherwise, if you are exposed to COVID-19, especially its Delta variant, you are likely, or it's possible that you can get infected. We cannot protect you from that. However, the vaccinated population has been shown to be responding better in the event of this infection that could or is likely to come your way. That better response reflects itself in a lessening of demand for healthcare and clinical interventions by the population's healthcare givers. I've heard it said by persons who advance their cause for not vaccinating themselves that, well, vaccinated people still getting the virus. That is true. Some. But the vast majority of them are not in the hospital. But on the contrary, the vast majority of people in the hospital requiring a doctor, a nurse, and all the carryings on around your bed, including equipment and support staff, that happens largely to the people who are not vaccinated. And on that basis, we've been saying there is a benefit to being vaccinated. I've seen it being said to by some people, my body, my choice. You're missing a phrase that you should add to that placard, and that phrase is my consequence. Nobody's saying it's not your body. Nobody's saying it's not your choice. But we want to say to you, it is your consequence. If you end up in a situation in the pandemic of the unvaccinated, which is 90-odd% of the people in the hospital, what more can we say? If you choose not to be vaccinated, which is the only relief that's available in this situation, of course you don't have to believe me. I've known people who said they're not concerned about the AIDS virus because they just eat fish. And I know 2 of them that are not with us now. Maybe it's because they have too much fish. The bottom line is, if you take that kind of approach, disregard the science, and get down to that level of understanding, you're on your own. But I'll tell you something. The people in the hospitals who have been working for a year and a half, some of them 7 days a week, and some of them 18 to 20 hours a day to try and keep the unfortunate alive. If you end up at the hospital and you're hearing that more and more people are turning up in the accident and emergency, COVID is not an accident. It's a huge emergency. So that reference to accident and emergency, forget the accident part, it is the emergency. When water more than flour, they head for the hospital and they are an emergency case. But of course, you're also told that they are highly educated, smart people among us, some of them entrepreneurial in their actions, encouraging people to use medication for which there is no certification for its efficacy. Stay home and use it. When you go to the point where it appears as though you can go no further at home, you come to the hospital, there are no miracles there. There are no miracle workers there. What you have are tired doctors and nurses, some of whom have said to me that they are thinking about getting out of the arrangement because they can take it no more. Because the people they're caring for don't seem to want to care for themselves. And it's not fair to them. And it's against that background that today I want to comprehensively dismiss the behavior of some of my parliamentary colleagues, especially the leadership, who are seeking to place blame for the circumstances that we are heading into or that we are into on the healthcare givers of Trinidad and Tobago. I want to say, as Prime Minister of Trinidad and Tobago, our healthcare givers have been exemplary in this pandemic. And I will take no advice from persons who want to segue into arguing that we are in this situation because of some failing on the part of the healthcare givers in Trinidad and Tobago. Nothing is further from the truth. The virus is relentless. We do not have barriers to prevent it that are 100%, but we know there are some things that we can do. And they work to a certain extent, all the way up, from mask to vaccine. These are the things that human beings have been doing, can do. But in our population of approximately 1.4 million people, we have 600,000 people who could be vaccinated, who are not vaccinated because of a decision that they have made not to use the relief that's available through vaccination. The numbers are now down to less than 1,000 a day, 1,200 a day, down from what, 15,000, 20,000? That should tell you that we are not vaccinating, not because we don't have the vaccines, not because the science is not showing us that if you are vaccinated, you are not likely to end up in an ICU. But a lot of conversation, my right. I met with the doctors this morning, as I normally would on a Saturday morning, and I've told them we got to the point now where the numbers are not helpful in understanding our situation about how many people. We always knew that that was confirmed numbers of those who come before us. There are a lot of other people out there who might have been COVID positive, but asymptomatic and going about their business not knowing. That's the nature of the business. Or they may have got sick and we said to them, if you feel sick, stay home, don't go to work, and recovered and so on. But the bottom line is, if you are vaccinated and you come up in that situation, asymptomatic, with some symptoms that don't require hospital care, you're fighting the best fight that's available. On the other hand, if you're not vaccinated, the risk of you being in that 15% of the numbers, it will show up. It will show up in the hospital. It is now showing up in the hospital. I did say before, it is not possible to have a bed reserved for everybody who gets sick. There's a limited number of beds in a limited number of hospitals. That means a limited number of situations for immediate health care. And more importantly, a limited number of the trained healthcare professionals to deal with the population. I know it is being said that maybe we should have tens of thousands of doctors and tens of thousands of nurses, but that is just old talk to fill space. Right? We have exceeded our normal supply of healthcare givers to respond to the pandemic. We are exceeding it in many instances. And the state will continue to provide what is available or what is possible. I've seen it said that, well, only some people could get care. Those who behave well and those who don't behave. Everybody, even those who behave well and who don't behave well, the healthcare givers are under the Hippocratic oath to treat everybody equally. And therefore, there is no situation to come where those who behave in a cooperative way will get the health care and those who don't will not get it. Once you turn up in the hospital, you are the responsibility of the health care givers there. It doesn't matter how you might have behaved. Whether you fall out of a plum tree, whether you should have been driving so fast, doesn't matter. Once you are a patient there, all patients are equal. So the person who is the Facebook specialist, or the bush medicine specialist, or the ivermectin specialist, when they turn up at the hospital having made those choices, may be depriving you of the attention that you should get, because it's not a lot there. And the danger we're facing now is that this parallel healthcare system that's worked so well for a year and a half is close to breaking point. When it breaks, as it would if those curves don't turn down, when it breaks, it will not break in the parallel healthcare system. It will rush to shore on the healthcare system itself, the general healthcare system. Because persons who are sick, not leaving home to go to the parallel healthcare hospital, they're going to the hospital. And once they get there, they become part of the hospital care system. And the next thing you know, if we don't treat with this situation, normal healthcare provision for the normal citizen in elective and non-elective conditions will then come under pressure, and that is when the healthcare system will collapse. And I'm saying, after all we've done for a year and a half, it will not collapse because of the doctors or the nurses or the healthcare givers and all their specialties not doing what they're supposed to do. It will collapse because of the lack of cooperation of a significant chunk of the national population. It will collapse because of that non-cooperation. Your body, your choice, your preference of uncertified medicine, your lack of cooperation with wearing the mask, your lack of cooperation with staying away from people who you think the numbers are too large, you want, and of course, you have to party, you have to do this, you have to do that. One of the things that we have to do in this pandemic is to stay as isolated as you could. That's one of the things. But you have to go to work, you have to do this, you have to do that. And when you do that, you do it to some care. If you are carefree, then there's a good chance that you may be contributing to the collapse of the healthcare system. And you see the blame game matters not if you're lying in a hospital for one reason or the other. Doesn't matter who you blame. It is your condition and the success of the treatment that's going to come your way that matters. I heard one of my colleagues asking for a commission of inquiry as to why people are dying in Trinidad and Tobago from COVID. These are unhelpful comments. Because I can tell you, there are developed countries now which are facing a fourth wave. Not a first, not a second, not a third. A fourth wave, because such is the nature of the virus. COVID-19 has not been suppressed to oblivion anywhere in the world. It is going in cycles. And the only thing that we are all relying on, developed or undeveloped country, only thing we are relying on now for some relief and some element of control and risk reduction is a vaccination program. Nothing else is available at this time other than the protocols that we have been following before the vaccines became available, and we combine that with vaccines, and that is the response to COVID-19. Unfortunately, a significant part of the population seems to be becoming numb to the fact that every day we lose 8, 10, 12, 15, 20 people. I ask you, if an invader came ashore in Maracas Beach or in Carnage and killed 100 people in that invasion, would that level of indifference have been the response? And then they kill 1,000 people. What would have been our response? Could we have been so indifferent? Every day. I understand that today are 22 families today burying their dead. This is not a light matter. But at the same time, the response in a situation where 600,000 people will not cooperate, the response cannot be that, well, to turn the curve down, we shut the country down. It can't be the response. And therefore, the government's position is that we will continue to soldier on in a pandemic, that we have done everything possible that we could have done, but we have to live. We have to work. We have to have an economy. We came out slowly and cautiously, carefully. And if a wave, like our third wave, is to come, the automatic response is not to shut the country down again. The response is to work harder to live with the virus, and let's see if we can all survive it. Because the shutdowns are not replacements for responsible conduct, starting with using the vaccines that are available. Yesterday in the Parliament, I was being pressed by my colleagues in the Parliament to say whether we have placed orders for medication that is to come, because some manufacturers are saying that they have medication that could relieve the condition of persons who are infected with COVID. If those medications are certified as being efficacious, we'll want to have some of it. But the way the questions are being put to me, in fact, one question was put to me is that, are we going to, if I could assure the country that we will have this medication for every person who is, unfortunately, to be infected, I just want to let you know that the medication that they're referring to, the cost of treatment for one person is approximately 30 or 40,000 US dollars. Multiply that by the number of hundreds of thousands of vaccines that we have been using at a cost of $0, $5, or $15 or $20. So to hear that something might be coming your way if you get sick with COVID, and all that had to happen, the government just kept it and bring it, that's another challenge. Because I have not heard that kind of price for medication outside of the treatment. There are some cancer treatments that are in that ballpark. to talk about widespread use by the general population at that price, I want you to do your own mathematics and understand what you're talking about. So I tell you that so that you will reconsider your position, wherever you might be, and consider whether you want to count yourself among the vaccinated. It's a moment of inconvenience. I could tell you, I had my third vaccine yesterday. Moment of inconvenience that could save a lifetime of trouble and could save a nation from serious dislocation. But it might very well be that talking to the general population about the condition of the general nation might be a waste of time. I've seen descriptions of these events that we have on a Saturday, which are far from flattering, because some people believe that we do this for our benefit, but we do it for the benefit of the nation. And I know for a fact that there are hundreds, if not thousands, of people in the Ministry of Health who are doing it for the benefit of the nation. Not for the salary that comes with the job. Not for their family alone. Not for themselves. But they are putting themselves out there in the breach for the rest of the nation, for the benefit of the nation. And therefore, they deserve the respect, they deserve the consideration if we're all going to go through this. I don't know what's going to happen to us going forward. But what I do know is that the science tells us that we can get some relief from the vaccination program. But you can't vaccinate your shoe. You can't vaccinate your headdress. You have to vaccinate your body. A decision made by you personally to protect yourself, to protect your family and loved ones, to protect your community, and to protect your nation. Unfortunately, for a significant portion of our population, that is too much to ask. I just want to remind you all of the behavior of the population in March of this year, when vaccines were largely unavailable. Everybody gave the impression that all we have to do is to vaccinate the nation and we'd be all right. Get the vaccine. Vaccines were hard to get. We went through hoops. We went through turning gears. We eventually got vaccines. Now we have vaccines. That conversation is now attracting a response from the Minister of Health, telling us that we hit a wall. The program has stalled. So how come in March it was the solution? We know enough about vaccines to know in March of this year that if we vaccinated the population, we'd be all right and can get back to some semblance of normalcy. How come in March we knew that? But today, the minister is reporting that the vaccination program has stalled with 600,000 people out there unvaccinated. I was in London last week. Oxford Street, which is the busiest shopping street in London, even though they have outbreaks of infection in England, Oxford Street was like nobody's business, normal. People were hardly wearing masks on the street. The responsibility was that if you're going to public transport or if you are indoors, you have the option you choose depending on how you think your personal risk is, personal responsibility. You wear a mask. But out in the open in the street, because the population had been sufficiently vaccinated to allow that to happen, the vaccination is 85%. 85% vaccinated. It means 85 people in every 100 are vaccinated. But that is no guarantee that you won't get an outbreak, you know. But at least it allows the economy, it allows the persons to get going. It allows the country to get back to some semblance of normalcy. And because they're all vaccinated to that level, there's a bit of comfort in interacting going forward. Of course, you could point to situations of high vaccination and there's an outbreak. Yes, outbreaks are possible, but the outbreaks may not be permanent and they may not be destructively damaging. If we were at 70 or 80% vaccinated, we too could have gone that way, because that is what the science says to us. If you have that level of vaccination, you could have activities of that nature. We are having demands for certain activities here. When I spoke to you 3 or 4 weeks ago, or about 6 weeks ago, I think it was, I mentioned that by this time, we were hoping that we could have opened our beaches and we could have started back contact sport and so on, providing we had been able to have a higher level of vaccination and a report of lower numbers with respect to the concentration of the virus in the population. Unfortunately, that has not happened. So, much as we would like to open the beaches now for all the good reasons for open beaches, or for having sport, against what we are being told here, it's just not on. But there are other things that we will do. It was being misrepresented in recent times that the state of emergency was the government's way of bullying the country to do what the Prime Minister wants, and the government to do what it wants, and it was to fight crime, and therefore we have murders, so therefore the state of emergency has failed. Let me just remind the population what the purpose of the state of emergency was. It came into being in May, before we had a significant number of persons vaccinated. It was a holding arrangement to reduce the period of exposure and mixing until such time as we could have a rollout of a vaccination program. We've done that. We've been under a state of emergency since May, and according to the existing laws, we can go no further beyond the 30th of this month. I just want to advise the population that while we can't do other things, what we can do now is to remove that restriction and allow those elements of the economy for whom the state of emergency and the curfew is a stricture of some kind, and allow the population to take more responsibility for itself, because this is what it is going to be. There is no shortcut. We are now to confirm that the situation that we are in with COVID-19 is a long haul. It's a long haul. And therefore, the state of emergency gave us breathing room to start and continue the vaccination program, but we can do without it now. So on Wednesday, the Parliament will meet, and we will discontinue the state of emergency, and we'll continue to manage the vaccinated population and the unvaccinated population under the Public Health Ordinance. And just to clarify, it would mean that under the Public Health Ordinance, we will have restrictions where you would still require to be masked, because that is one of the simple action, but is one of the reactions that give us some element of protection. Public gatherings will remain at 10. Public fetes and parties in all their forms for the time being will remain prohibited. We will continue with what we are doing with the schools and our school children. Religious services will remain the way they are, except that we will permit the occupancy of internal gatherings to 50% for religious activities, which will remain no more than 90 minutes. So you'll get a bit more space usage, but the time that you'll be exposed in there to be 90 minutes or less. Internal use to be 50% for christenings, weddings, non-religious indoor events at 50% capacity. And graveside, we will allow 25 persons at the graveside. It was 10. We think 25 will allow more persons to cooperate with the law. And I'm speaking here specifically to my friends in Western Tobago who seem to have great difficulty staying away from the graveside in a particular graveyard. So at the church, you can have 50% occupancy at the church for mourners, but at the graveside, 25 persons at the graveside. Bars and restaurants and cinemas would operate their full service as they're going now and continue at 50% capacity. And of course, this is for vaccinated, safe zone use. Public transport will remain at 75% capacity. Our border arrangements will remain in place, no change there. And consumption of alcohol in a public place will remain prohibited for the time being. And one safe zone that we want to add, because there's a lot of requests which we think we can manage to cooperate with. There are a number of persons for whom the therapy at public pools is something that is very important for their health. We will allow public pools to be used by vaccinated persons. So all vaccinated persons can use public pools. So in other words, public pools are to be safe zones, staff and users. By eliminating the state of emergency, we'll bring some relief to the police service, who, like the health service, have been under tremendous pressure, backed up by the Defense Force. But now that the state of emergency is to be lifted on Wednesday, we will, and I've already met with the Minister of National Security, who I think would be off to talk to his charges, we will enforce the laws and regulations with respect to cooperation of these actions that I'm mentioning here. I've been hearing about parties because some people just have to party. These people don't understand that it's a question of life and death for many people. And I am here appealing to law enforcement to let the full weight of the law be brought up on persons who are undermining our COVID fighting efforts. The regulations will come out. It will be spelled out. You will know what is legal. You will know what is illegal. And we are asking you to avoid coming up against law enforcement that will be directed at you. You can avoid it. So I'm hearing about persons making their homes party zones in some areas on a nightly basis. In other words, they are not concerned about what we are concerned about, which is the spread of the virus. They're not concerned about the death and damage to families that are taking place. They're not concerned about the tired hospital staff who will receive those who are infected. All they're concerned about is that they have to party. And that is one of the environmental conditions in which the virus will spread. We're asking you to understand that we are in a desperate situation. Don't let it become more desperate and then look for somebody to blame. Because I know that's what's going to happen. when we find ourselves in a condition where we don't have enough beds in the hospital, and it starts backing up into the normal health system, and then they start backing out of the corridors, is a blame game. That will not impress me. That will not help you. Because a lot of what we are facing now has to do with personal responsibility and regard and respect for our circumstances. So we continue to look to see where we can make changes, but for the moment, much as we would have liked to, we will not open up further, but we also will not roll back into any cocoon. We're asking we get more resilient, more cooperative in living with the virus, fighting the virus, and cooperating with the health protocols and other restrictions that may be in place. If you have any questions, we take them now.
Hi, good day, Mr. Prime Minister. Shane Superville from the Newsday newspaper here. Going forward, as far as the public information campaign is with respect to vaccinating, is there anything the government is going to do different? Is there anything they can do different in addition to what's being done to try and get this figure of 600,000 people vaccinated? And secondly, the situation we're seeing now, could this eventually go into a place where the public may have to pay for vaccines going forward in the not too distant future?
Well, for the moment, let me answer the second part first. For the moment, we are not considering asking people to pay for vaccines. We make vaccines available for free. As a matter of fact, we have a stock of vaccines which is available for free, and we're not thinking at this time of changing that. Secondly, you ask whether we're going to do anything different. Yes, we'll keep doing different things to inform and encourage the population to do what we think is the only effective response at this time, which is to get vaccinated. And the Minister of Health and his team, they've been doing different things, some of them quite innovative. Some people are hiding behind hiding their lack of cooperation behind the fact that they don't know enough about the vaccine. Well, we'll keep trying to let them, I don't know that the biology of it and so on is what they're talking about. I think they're talking about the dangers of tomorrow when the vaccine is taken. But when you start talking about, when such a person's problem is that they don't want to turn up at the pearly gates with something implanted in them by Bill Gates that identify them as the mark of the beast, what does one do with that? How does one deal with that? And I am afraid that a lot of people have those kinds of issues that are completely outside of the pale and the realm of the science of you being threatened by a virus and a biological response of a vaccine immunization program. And you are going down a road about, how St. Peter will identify you when you get there. And as a result of that, you will not take the vaccine. I don't know that I can help any further. The Minister of Health and his team, the volume, the concentration of advertisements about the availability of the vaccine, the effect of the vaccine, how it works. You have your nurses, your doctors. They are the trained people. They are your people. You pay them. They tell you how to protect yourself. And you choose to listen to somebody, nameless, faceless person. I don't know if you all saw where it was confirmed that there are about 12 people, who have been responsible for 80% of the misinformation that has been put out on social media about the world's vaccine program. 12 people. Because the technology allows that to happen. And unfortunately, even as you pay doctors, you pay nurses, you pay specialists, and they come to your assistance now. You don't listen to them. You want to listen to people who have other stories, conspiracy theories. And while that is happening, Dr. Richards is telling you, the hospitals are filling up, the beds are being used up, the doctors are tired, the nurses are tired. We can't just go and buy 2 more in the market like a basket of apples. We don't buy doctors in Price Mart. Right? It's a limited number of specialists here. And of course, getting intubated and going on a ventilator is not a pleasant experience for anybody. And most people who end up there come out feet first. But the doctors and nurses try to save a life all the time. What more can we tell you? If you take the position, some people are actually on the verge of violence to prevent themselves from being counted among the vaccinated. All I can say to that is that that is part of the pandemic experience.
PM, if
let me just take Uvashi's question.
Mr. Prime Minister, what I found was a little bit concerning was Dr. Richards. What I found was a little bit concerning is Dr. Richards' revelation that 5 children are in ICU. Would she be able to say if those in ICU require any sort of ventilation, and also if those children have any underlying medical conditions? Like, I know that in Trinidad we have a high rate of childhood obesity and diabetes.
Good afternoon. Thanks, Prime Minister. Yes, there are 5 children in the parallel healthcare system, of which 3 of them are in ICU. So I'm just clarifying that 3 out of 5 are in the ICU. Once a patient is in the ICU, they are being ventilated. So they are receiving, ventilatory support, and all the other support that they would receive, they would be sedated, and so on. However, out of patient medical ethics and patient confidentiality, we can't go into details about the actual clinical status of these children, but we would just like to remind the public that these are children now, and this is a trend that we started seeing in September or so when we were reporting on it, August, September. But as of over the last week, 5 children have been admitted, and over the last 3 to 4 days, 3 of them have been admitted into the ICU of the parallel healthcare system.
Would you all also be able to say if the increase in childhood, hospitalizations is consistent with the Delta variant?
I think what she's asking is whether the Delta variant has been responsible for those children.
Well, the Delta variant is well established in our community. Dr. Hines would have been indicating this, and from the first case in August to present, Dr. Hines, Dr. Paris Ram, and others would have emphasized the higher rates of infectivity and clinical severity. At this point in time, I do not have access to the genotyping or genomic sequencing for those children, but it does not take away from the fact that there are 5 children in the parallel healthcare system, and 3 of them receiving, ventilatory support in our ICUs. Thank you.
Let me, against the background of your question, Uvash, let me just touch on something here. The data that we're interrogating show 2 things which are related, possibly related. There's an age group between 25 and 40, 25 and 49. That's where most of the resistance is to being vaccinated. Largely because many of those persons are male and they have reasons to suspect that they could be affected by the vaccine, or that they are sufficiently strong and will overcome the virus. But that being so, the deaths are the other end of the spectrum. The older people are the ones who are dying. And one doesn't want to come to the conclusion that the Cavalier cohort is taking it to the vulnerable cohort and killing them off. I know senior citizens who have gone nowhere outside of their room and got killed by COVID. because somebody came to them, brought it, and they couldn't resist it. They said didn't survive. And therefore, that is a cohort of people. If you are young and you are strong, take it from me, the experts have said, I've heard them myself saying that there's no relationship between your sexual prowess and COVID and its treatment for COVID. That is just old talk. That scare is old talk. I've seen the experts saying that, I believe them. And also, if you think you're young and you're strong, you should be the cohort that is out front defending the nation by doing what has to be done, by getting vaccinated, rather than saying that I am strong so I don't have to get vaccinated. And the next thing you know, you might very well be a carrier, an asymptomatic person who would have been infected. I mean, the person I heard about this morning, last night, who's regularly going to the supermarket while being COVID positive and know to be COVID positive. I don't know who they've infected. But that kind of action is what keeps a population, right, providing the environment for the virus to propagate itself, where that personal kind of understanding is. So that is, again, part of the pandemic experience.
As it relates to your position on not opening the beaches, what is the fear? What is the concern about opening beaches?
Okay, let me explain what that is, because we wanted to do that quite a while. As I can tell you, I mean, it was last, 4 or 5 weeks ago I mentioned that. The fear is that once we open the beaches, open beaches attract a certain kind of activity. And that activity is coming together, crowding, and partying. Or, if not at the beach, it's after the beach line, or entrepreneurially at beach houses associated with the beaches. That's what we're afraid of. Not the beach itself, not being in the water or being on the beach. And we've pressed our healthcare staff on this matter. And they are very concerned that given the condition that we are in with respect to the response at the hospitals, any non-priority gathering of that nature is going to put pressure on the system, a pressure that we could hardly afford. Because you know what's going to happen if we say beaches are open, especially with a population saying, allowing to go on the beach. What's going to happen at Maracas? What's going to happen in Tobago? It's affecting people negatively. But what is the corollary? Right? If we do it and it contributes to what we are onto here, the second state could be far worse than the first. So we are holding it for a little while, but I'm hoping that before Christmas, we should be able to go back into the beach environment with some kind of restrictions. In fact, well before Christmas, I would say that maybe we could start with some morning opening up, especially for those people for whom that going to the sea in the morning to get that therapy in the water. I am very concerned about that, and I mean, I've tried to get that going, and I presume that in the very near future, we should be able to do that and just absorb that element of risk. But the general opening of beaches, it is the associate. I mean, you know what a river line is like. We open up rivers, immediately a river line becomes a place of congregation. And like the mask, like the sanitizing, right? You know, that congregation is what you're trying to minimize, especially where we have had to congregate, going out to work, traveling to go to school. Those things we have to do, so we do that. But the ones that we don't have to do, we hold on a little longer with that.
As it relates to the SOE and the removal of the SOE on Wednesday, as you have promised, is it the right time, since it appears as though we're on the cusp of a new surge?
Well, it's never going to, as I said, it was about giving us time to do certain things. And the main thing, the time we were buying was to get vaccinated. We've got 600,000 people vaccinated. So a state of emergency would have served its purpose. And we could, you know, we can't expect to carry it much longer because in any case, it will end on the 30th legally because we're not going to get it to go beyond that. It would require parliamentary approval, and we know what that means in some people's quota. But that's not the reason we're changing it. We're saying that we are getting the population to a stage now where we are accepting normalcy, and the non-restriction would gradually take the business sector into that arrangement. For example, you can not be home. We're not putting a curfew on, and we're just asking the population, don't focus on being held by a state of emergency. Focus on doing the personal thing for your personal safety. That's what we're asking you to do.
Good afternoon, everyone. Kimberly D'Souza, TTT News. Prime Minister, the Minister just said that the vaccination program is looking a bit dim, but no Prime Minister for you. But I know that you said that we are soldiering on regardless. Is the government still going to consider bringing out more of the student population next year?
Well, we're a little away from next year, so I wouldn't want to, we would want to. We did say January, and I'm hoping against all hope that in January we are not in this situation, and we also by January we would have seen what would have happened with our children in this term, right? The senior children would have been out this term, and we will take that decision closer to January, right? And hopefully the condition would allow us. But because basically we've had, children away from school now almost 2 years. January will be almost 2 years. It's not a good situation. So if it can be done, we will do it, and we'll make every effort to do it if it can be done. If we don't do it, it is because our circumstance is not as good as it should be.
For the folks at home and for my well-being as well, the SOE itself will be lifted come the 30th, or will it be on the Wednesday?
On Wednesday, Parliament meets, and we will take the requisite resolution, and it will come into effect immediately.
Given the need to have the population, well, more of the population vaccinated, are there any considerations to have government offices or services available only to those who are vaccinated in the same model as the safe zones?
Well, let's put it this way, right? We are in uncharted waters here because we don't know what the long-term arrangement is with respect to this virus, the long-term arrangement. We're almost into 2 years of this virus. We don't know how we will end the onslaught of the virus. What we do know is how we can better ourselves to respond to the virus. So we will have to consider all options going forward. We have to consider all options. And the safe workplace will always be one of those options.
Prime Minister Raphael John Lal from Guardian Media. In terms of the socio-economic fallout from the virus, we've seen a lot of businesses close, poverty rates go up. Well, we are a few weeks away from Christmas and the year ending. Do you foresee or do you project a positive economic growth at the end of this year? Because we know even before the virus, the pandemic had hit the country, had been in economic doldrums for some years. And looking on to 2022, in terms of unforeseen circumstances, you spoke about how expensive it is for certain treatments, 30 to 40,000 US. Do you expect the government to dip into the HSF financially for any unforeseen circumstances?
That's a long question, and it covers a lot of issues. We would have done what had to be done using whatever resources we've had, and also business closure, carrying with them certain automatic developments. When a business closes, certain activities are no longer taking place in that business. And persons who are associated with carrying on that business are now without jobs. That is not the environment for economic growth. So you try to avoid that situation if you are after growth. We want growth in the economy, but we have to be alive to experience growth. So the things that we have been doing to protect ourselves have been the things that have been depressing economic activity. And that is why I'm saying, even though the numbers are not helpful now, we are not going to roll back the economic activities that we have opened up on, because we really need to have that in parallel. And I have also said, even if the situation worsens beyond where it is now, we ought not to see the solution to that, the first action, as a restriction on the economy. Right?
The government be going back in the HSF as you all did really last year.
Well, the HSF is a savings account, eh? And if you are in difficulty, especially a life and death difficulty, I would think that your savings is part of your asset base. As to what you do or what you don't do, we manage that along the way. The Minister of Finance has been managing that. We've been using the interest, the earned interest, to help us across this period. The HSF is not something that, notwithstanding what you heard, there is a reason why you had it. It's for a rainy day, and right now it's pouring, right? Thankfully, we have been able to not touch the capital. During the period, that HSF is invested in largely assets abroad that have been doing well. So even inside of the pandemic, it would have been far worse if the funds have not been doing well. You know, if you see the market abroad collapsing, then you know that we are in bigger trouble than we think, because we are connected to the market by way of our investments out there.
Mr. Prime Minister, along with children being away from the classroom, a lot of them are also away from our cricket fields and our football fields, basketball courts, and so on. Adults have approached me, parents have approached me and asked, you know, two adults could stand and have a bathe. Why can't we allow children back out? Has this got government attention at all? These student athletes who are probably in depression, some of them we're hearing are going into crime because, you know, they just don't have that opportunity to play again.
Well, it's a risk management exercise. And while we would like to eliminate the risk, we can't pretend that it's not there. And you know, you have to understand the consequences of opening up here, opening up there. If we say yes, we go out. I mean, I'd love to have people go out and play and so on, but what is that action? It's more movement. Dr. Hines will tell you the curves that he's shown us here, which Dr. Richards described them at the hospital door, are really about moving and mixing of people. That's what it is. Moving and mixing of people is what generated that. We anticipated that it could have gone like this, because as we opened up the economy, what we were doing was allowing more moving and mixing. And it is that moving and mixing which has generated this situation. So any additional moving and mixing could only add to this. And that's the understanding of it. Right? And if you notice, when we got into a situation in May, June, earlier in the year, how did we stop it? How did we deal with it? How did we curb it? We curbed the moving and mixing. And the fear here is that we don't want to get to a point where the only thing that is demanded of us is a huge stopping of the moving and mixing. We're still moving and mixing, getting some infecting, but we are carrying the economy. But the moving and mixing is what it's all about. You want to stop that. I mean, in the UK, when they had a big outbreak like this earlier in the year, they so shut down the moving and mixing that they prevented families from visiting one another. You remember that? You could not go visiting people. And if you had to see anybody, you were asked to see them on the pavement, one person on the pavement. That was to prevent people from moving and mixing. Such was it. And that's the root of our restrictions here. Right? When we stop this and stop that, stop this. Not because you want to punish anybody or penalize anybody or arrogate unto ourselves any authority to play God. It was just the moving and mixing. The more moving, the more mixing, the more COVID spreading. Fact. Okay? Thank you all very much and stay safe.